Healthcare, Obamacare, Medicare, who cares? Well, you need to care in order to get quality care. Who else is going to pay that overly expensive medical bill for you? Speaking of paying, our US government has been spending more on healthcare than any other country in the world, more than 15.2% according to the World Health Organization. Nevertheless, that percentage is rising and expected to rise to 19.5% by 2017. Some might think that's good, right? Spending more on something important, so we should be doing better than the other countries, right? Nope, even Canada is beating us. It's one of the things why Canada is pretty great. Although we're number one in healthcare response, the reality is that the United States is one of the lowest ranking nations in quality healthcare, and even has a lower life expectancy compared to other rich nations that spend less than we do. What's even worse is that about 48.6 million US residents are living their lives without health coverage because of cost and qualification problems with the government health programs. By the way, if you're wondering about the governmental programs, Medicare and Medicaid, the difference between the two is that Medicare is an insurance program while Medicaid is a financial aid assistance program. Both were in 1965, Medicare was formed from the actual Social Security Act, while Medicaid was from an amendment to that act. This is the primary reason of the talks about healthcare reform. In fact, we're going to talk a bit about Bill Clinton and Barack Obama's influence on healthcare reform. Let's start first with Bill Clinton, our 42nd president. He has done some great work both in the US and internationally, but sadly he's most commonly seen through the lens that was made by the scandals he was involved in. Getting back to the main idea, Bill Clinton pushed for healthcare reform in his campaign from the start of his term back in January 20, 1993. To start this push, Clinton organized a task force that would be led by his wife Hillary Clinton to create a plan of reform within 100 days. This didn't exactly happen within 100 days, however, due to conflicts with Clinton's economic team. He said that the plan is too complex and should be more incremental. It's like eating your hot dog in small bites rather than swallowing it whole while chewing. A major choking hazard for the US economy. The bill later was submitted to Capitol Hill on October 27, 1993. Which was 288 days. The main idea was that Clinton wanted universal health care to cover the uninsured. He never wanted a government that would pay for all the healthcare costs. This is called single-payer system, which is installed in countries such as Canada and New Zealand, but it's quite frowned upon as socialized medicine in the US. It would be too much government. To add on the list of problems, the US had and still has a very complex healthcare system, in which it consists of a mixture of private sector businesses and public financing of Medicare and Medicaid. The Whitewater scandal and the opposing Republican Party seemed to make the plan destined to fail. To make things worse, some Democrats suggested their own ideas, which also failed and weren't very simple either, rather than supporting the plan. Interest and lobby groups worked together against it. If you're old enough, you might remember the ad about the middle-class couple, Harry and Louise, which ended up being very effective.
This was covered under our old plan.
Oh yeah, that was a good one, wasn't it?
Things are changing, and not all for the better. The government may force us to pick from a few healthcare plans designed by government bureaucrats.
Having choices we don't like is no choice at all.
They choose.
We lose.
For reforms that protect what we have, call toll-free. Know the facts. If we let the government choose, we lose. Call today.
The ultimate ending was the death of the bill. Politics and economy didn't happily support the ambitious plan or any other proposed reforms from the same Democratic Party. But what about Obama and Obamacare? Going past Y2K and Harold Camping's first prediction of the world, the Patient Protection Affordable Care Act, PPACA, of 2010, or Obamacare, was signed by President Obama himself on March 23, 2010. First ending off as the Service Members Homeownership Tax Act of 2009 by New York Democrat Representative Charles Rangel on September 17, 2009, it passed through the Ways and Means Committee, the House, and the Senate, where the name was changed to PPACA with flying colors. Of course, differences were ironed out and amendments were made to the bill. Similar to Clinton, Obama wanted to reduce the number of uninsured Americans. Before his presidency and his campaign, Obama did consider the single-payer system. However, as president, he knew he wouldn't get much support of the bill if this was going to be implemented to the plan. The main points of the bill are: 1. Stronger consumer protections and rights. This means insurance companies can no longer deny coverage to children because of pre-existing conditions, impose a lifetime dollar limit on healthcare expenses/benefits, and or drop your coverage when you get ill because of a mistake on your application. 2. Healthcare should be made more affordable. This means insurance companies have to give rebates if they don't spend at least 80% of your premium dollar on quality improvement or medical care, rather than commercial high-end employee bonuses. This is called the 80-20 rule. They are also required to publicly justify their actions when wanting to raise rates by 10% or higher in every state. Adding on to the affordable coverage, small businesses will gain tax credits for coverage for their employees. 3. Easier access to care. Insurance have to cover a number of recommended preventative services without additional cost sharing such as deductibles or copays. Along with more access to care, young adults can stay on their parents' plan until age 26 if they can't get coverage from their jobs. Have fun, parents. Adding on to the point of easier access to care, more offenses will go against insurance companies' pre-existing condition discrimination, which would be illegal in 2014. Temporary program, pre-existing condition insurance plan, makes healthcare coverage more affordable for those uninsured and have been denied coverage due to their pre-existing condition. Healthcare will also be more easier to access by the creation of the affordable insurance exchanges, which are one-stop marketplaces. This in turn helps create a competitive private health insurance market, which is state-based, for 2014. There would also be the creation of the Health Insurance Marketplace, which is an online shopping site where you can enroll in October 2013. Consumers can get private health insurance plans that fits their needs, same as the health insurance choices that congressmen have. Last but not least, strengthening Medicare. Seniors benefit through lower cost prescription drugs and obtain free recommended preventative services such as flu shots, screening for diabetes, and many more. There will also be stronger screening procedures and penalties with new technology to fight healthcare fraud. Overall, it will try to lower costs throughout the board and find new healthcare models to reduce costs / strengthen quality of healthcare via the Center for Medicare and Medicaid Innovation. Even though the bill is successful and no, it was not shut down by the Supreme Court, Chief Justice Robert K. Obamacare to the text form rather than a mandate and therefore is still considered constitutional, there are still those who want to repeal Obamacare. Their main points are that Obamacare goes against the Constitution, using the Commerce Clause. The bill promotes socialism, and that it would ruin job growth and raise costs of businesses, and other reasons. Finding some research from the government website, some of these arguments are proven to be myths and rumors rather than fact. In general, you can't make everyone happy and agree with you. In summary, people need healthcare and healthcare coverage. Whether it is a right or a privilege, and how it is implemented is all based upon business, beliefs, and politics.